A 34 years old gardener present with lesion affecting the dorsum of the right hand, and it has present past 10 days and occurred after he had pruning rose bushes. On examination, he has a raised ulcerated lesion with blades easily on contact. What is the diagnosis? So it is a typical feature. That means a gardener working in the garden, and suddenly he or she was injured by the bushes, and after 10 days, after 7 to 10 days, suddenly he developed a raised ulcerated lesion and which bleeds easily in contact. What is the diagnosis? Here the options are the keratoacanthoma, pyogenic granuloma, basal cell carcinoma, squamous cell carcinoma, and amylonotic melanoma. So in this area they are most carcinogenic, but here the options, that means here the history of the trauma. Here it is the history of the trauma, and history of the trauma by which? It is trauma by the rose bushes. So what is the options? So as it is the history of the trauma, so basal cell carcinoma, squamous cell carcinoma, and amylonotic melanoma, there will not be the answer. So we have to keep mind in keratoacanthoma and pyogenic granuloma. And here most important point, that is it is the history of trauma. Second one, there is the raised elevated lesion which bleeds on touch. So here we can see this is this type of lesion. That means first of all there is a injury. That means here is a history of the trauma in this finger, and after 7 to 10 days, here we can see there is an ulcerated there, or there is a elevated reddish mass, and here when it touches, then bleeds. In this figure also, here we can see this is the foot area, and in the foot, history of the trauma, and after 7 to 10 days, again this is the elevated mass develop, and as it is rapid develop, so when history miss, then diagnosis will be miss easily. So we have to take details history for any of the patient. Now here first of all, let's see the pyogenic granuloma. What is pyogenic granuloma? This is overgrowth of the granulation tissue. That means when there is the trauma by the bushes or trauma by the tree, small tree, in this condition what occurs when they are in recovery phase, then overgrowth of the granulation tissue occurs. And at a site of the minor trauma, that means it is occurred by very small substances, and it is bleeds on contact. So this 2 or 3 point is very important. First of all, minor trauma. Second of all, there is a swelling which bleeds on touch, and they may treat it with curettage and cautery. That means we have to curate the lesion. Formal excision may be used if there is a diagnostic doubt, but excision also be done when it is confused with the squamous cell carcinoma or any other cancer. In this condition, the excision may done, and following the excision, their histopathological examination should be done. And it is another picture. Here we can see this is the pyogenic granuloma, and in case of pyogenic granuloma, it is usually ulcerated, color red to purple, smooth lobulated, pedunculated or sessile, soft to palpation, and its size varies. So what is our answer? It is the pyogenic granuloma. It is very important that pyogenic granuloma, it occurs when there is history of trauma by the any type of a small tree, and it is the minor trauma. Second one, there is the raised ulcerated lesion, and third one, it bleeds easily on contact. So this 2 or 3 point we should remember for pyogenic granuloma. First of all, it is very a small trauma. Second one is raised ulcerated mass. Second one is the raised ulcerated mass, and third one is the it bleeds easily. So this, with this 3 point, it will be very easy for us to diagnose the pyogenic